I'm going to ask a probably controversial question. How often is like the diagnosis of like a psychological, disease, like I don't know if that's the right vernacular, but something like depression, anxiety, OCD, ADHD, a cover up for, something that's deeper seated versus legit?
I don't know if it's like necessarily a cover up. Like for with anxiety, for example, there's such a range, right? You can suffer from panic attacks, or you can have generalized anxiety disorder. I think that you can have those things, but maybe what you're getting at, and I would agree with this, is that there's more underneath that, right? So is there an imbalance in the autonomic nervous system? Is the autonomic nervous system in sympathetic overdrive, right? This person's operating in fight or flight response because of a metabolic imbalance, because of like a neurotransmitter imbalance that isn't really anxiety, but it's showing up as anxiety. And if that's missed, if that diagnosis is missed, that person is just going to be labeled as being anxious. So I think it's often maybe more complicated. There again, there's a hormonal imbalance, a metabolic imbalance, a neurotransmitter imbalance that is not being addressed slash recognized. And in a primary care visit, what happens is that antidepressant, that anti-anxiety medication is handed out. That's all that's done. And it's not looking for underlying issues, testing, et cetera, all the stuff that we do and kind of like really digging deep to find out where the imbalance is, what's going on maybe in addition to the anxiety or depression, or what's like, what really is at the root for this person. Because we're all different. And maybe it is trauma for one person and maybe it's perimenopause for somebody else.